Premature ejaculation is a common medical condition that affects about 10 to 20% of all men. It is defined as ejaculation that occurs within 1 to 2 minutes after vaginal penetration. Premature ejaculation can be treated. The type of treatment depends on the nature of the condition. There are two main conditions defined as primary lifelong premature ejaculation or secondary acquired premature ejaculation. The primary condition may have a genetic or biological basis and does respond well to oral SSRI, that is selective serotonin reuptake inhibitor medication. The secondary condition may also respond to SSRI medication, but may also respond to couples counselling, looking at the condition as a couple and providing exercises that have been in use for some time. Stresses in a man's life may be responsible for the secondary onset of premature ejaculation. This can include relationship problems, financial issues, domestic issues. All sorts of stress issues may aggravate this problem. It is thus best to treat premature ejaculation in this situation by looking at these lifestyle factors, addressing them first, and particularly looking at the couple in the relationship. Premature ejaculation can be well treated, but not always cured. Sometimes the treatment can be lifelong, and sometimes the treatment does respond to short-term advice, such as exercises, couples counselling, etc. These days, family doctors are much more confident in treating premature ejaculation. I recommend any man concerned with this condition consult his family doctor, who may be able to treat the condition him or herself, or will refer the man on to an appropriate sexual health specialist. Some of the medications have been in use for some time and are well proven in their effectiveness, and these should be discussed with your family doctor in a face-to-face consultation. As men age, it is quite common for their prostate to enlarge. This is known as benign prostatic hyperplasia. Some men suffer symptoms from it, and some men have no symptoms at all. Often the enlargement of the prostate has similar symptoms to the presentation of prostate cancer, or in fact, no symptoms at all. But any onset of erectile dysfunction in a man who may have prostate disease requires not only investigation of the erection problem, but also the prostate. Any man who suffers from sexual problems associated with prostate disease, whether it's benign enlargement or prostate cancer, should seek the services of a doctor with a special interest in the treatment of sexual problems associated with prostate disease. The return of sexual functioning after a man has had treatment for prostate cancer depends on the man's age, whether the erection nerves have been spared, and how good his sexual functioning was before the treatment. The treatments that are currently available include oral PDE5 inhibitor medication, such as Viagra, Levitra or Cialis tablets, penile injection therapy with prostaglandin or alprostadil, or use of a vacuum device. In some cases, the insertion of a penile implant is recommended. The success of treatment for sexual dysfunction arising from the treatment of prostate disease very much depends on the situation between the man and his partner. Couples are often included in the treatment program, and the treatment is often tailored to the man and his partner together. Male menopause, fact or fiction? It is known that women undergo menopause at a specific time in their life associated with a reduction in their hormones. On the other hand, Men have a very slow reduction in the hormones beginning from their 40s onwards. There is much controversy over what is the normal level for a man's male hormone, that is testosterone, at any stage of his life. However, that level is also controversial, as it is not known at what level an older man may or may not require testosterone. The level of testosterone at which an older man is said to be low in is controversial. There is no international consensus as to what is a normal or abnormal level in an older man. Testosterone is responsible for sex drive in men of all ages, but testosterone is also a requirement for maintenance of bone and muscle mass, for a sense of well-being, and for good cognition or thinking processes. Low testosterone may cause a reduction in libido, may affect bone and muscle mass, and may reduce a man's sense of well-being. Now, these signs are not necessarily specific for low testosterone and may also be due to other causes, such as medical conditions or psychological problems, such as depression. If a man feels he does suffer from these problems, he should consult his doctor with a possible referral to a hormone specialist, or to look at his lifestyle and other health problems that may be aggravating the situation. Part of the discussion of a man with these symptoms and his doctor will cover areas such as medical problems, psychological problems, including relationship, depression, and the doctor may treat the patient himself, or may refer the patient on to a specialist in hormone treatment. I recommend you go and see your local doctor who'll make an assessment of other causes of low testosterone or symptoms related to it, and that doctor will decide whether you should have testosterone replacement therapy or not. I recommend you go and see your local doctor who will make an assessment of your situation, whether you need testosterone replacement therapy or not. If your doctor feels you do require it, he will prescribe it,